so this is my demonstration for IV injection with a PICC line. My patient is Bob Owens. He is going through chemotherapy, so he has a PICC line in. He's currently expressing that he has pain, so I'm going to get him hydromorphone for that pain because it is on his order. So I'm going to check my chart and my order. Provider has ordered 1 milligram IV push every 3 hours as needed for pain of the hydromorphone. So I will start by checking his chart and making sure that he does not have any allergies. I see that Bob does have an allergy to morphine, but that is different than hydromorphone, so I am okay. Next thing I'll do is gather up my supplies. So I'm going to get my pre-filled syringe of hydromorphone. I'll also get 3 saline flushes, and I've got my alcohol swabs. Upon getting these out, I'm going to check all of my syringes and make sure that my expiration is okay, and none of them are expired, so that's excellent news. Now that I've done that, I'm going to grab my Betty book, and I'm just going to take a peek at that IV push of hydromorphone, and I see that it does not need to be diluted, so I will be good to use it undiluted as is. And then I also see that it should be pushed over a total of 2 to 3 minutes. So I want to make sure to do it at that rate to prevent any complications. Now that I've done that, I would also be familiar with my facility's policy on heparin flushes, being that I'm going to use the PICC line. My facility does not use heparin lock, it's just saline, so I don't have to worry about that. I would also consider compatibility with any IV fluids that are also running at this time. Bob does not have any fluids, so I don't have to worry about that, but I would check it against other solutions that he may be getting if he were to be getting any. At this point, I can get dose accurate with my hydromorphone syringe, since I am just going to use it out here rather than drawing out of a vial. I see that I need the 1 milligram. This particular one is hydromorphone 2 milligram per 1 ml. So just quick math on that. If I only need 1 milligram, I need a half ml, 0.5 ml. So I'm going to take this and either over a garbage can I would do. I would get a second nurse when I'm wasting, just to make sure, being that it is a controlled substance, that we're all being held accountable. So I do want to get my air bubbles to the top as best I can, and then I'm going to come down and we'll pretend like pharmacy sent me a 3 ml. That's a big tube for it. And I'm going to go down to 0.5. Get air bubbles out again. Okay. So now I am at 0.5, which will make me dose accurate. That being all set to go. I'm also just going to take a peek at my flushes and going to get all the air out of those right away too. All right, now that I am at this point, I can do my 5 checks. I'm going to do them twice here, and then I will go into my patient's room and do the last one at bedside. So I'm looking at my order, and I've got Bob Owens. We are giving hydromorphone 1 milligram IV push every 3 hours as needed. It's been over 3 hours since his last dose, according to his chart. 1 milligram by my math ends up being a half ml of, and there's my half ml, and it is hydromorphone. And we're going to Bob Owens. We've got hydromorphone. I've got a half ml, which comes out to 1 milligram, since a full ml is 2 milligram. I'm going to give that IV push through his PICC line, and it can be given every 3 hours as needed for pain. It's been over 3 hours according to his chart. and just checking it one last time, and then I'll do it again at bedside. Hydromorphone 2 milligram per 1 ml. That comes out to a half ml, 2 milligram per ml, which comes out to a half ml. So I can administer only 1 milligram IV push every 3 hours as needed for pain, which was given over 3 hours ago last time. Now that I have checked that, I'm going to take my things with me into Bob's room. And come on in. Hi, Bob. I'm washing my hands and providing for privacy. Bob, my name is Bree. I'm your nurse today. I'm just following up on that pain that you said you were in, an 8 out of 10. So we're going to get you some Dilaudid if that's all right with you. Yeah, that should help with your pain. We're going to go right through your PICC line with that. Since you have had the Dilaudid previously, you probably are familiar with some of the side effects. It might make you kind of sleepy. Sometimes it slows down your respirations a little bit, might feel a little bit woozy. You can tell me if you do have any feelings changing after having it. Otherwise, I will be monitoring you for any adverse reactions as well. Bob, can you tell me your name and date of birth? And he tells me his name is Bob Owens. Birthday is 9/22 of 33. I'm just going to check that against my chart right away. Bob Owens, and his birthday is that 9/22 of 33. So I've done a couple checks on identifying him. Bob, I just want to do real quick. I'm going to do a last check on the medication that I have for you. So again, I do have Bob Owens, and my chart is for Bob Owens, and we are doing that hydromorphone, 2 milligram per 1 ml. He has 1 milligram ordered, so I am giving him a half ml, and it is going to be IV push through his PICC, and that is every 3 hours as needed, and it has been more than 3 hours. So I'm just going to put this down here because I don't want any issues there with it leaking out of the container. Okay, now that we're all set, I am going to wash my hands and put on a fresh pair of gloves. Bob, I'm just going to kind of look around here. I'm assessing your insertion site, and there's no sign of any sort of irritation. It looks like it's still perfectly in place. I have no concerns about the IV site. So, facility calls for using the proximal of the triple lumen. So I'm going to grab the proximal, which we're going to say is this one here. It's clamped. So I'm going to go ahead and clean that. According to my facility's policy, we'll say it's for 15 seconds, and that 15 seconds has now passed. Going to make sure that there's no air. Oh, let me undo my clamp. And we're going to go ahead and flush. And everything looks good there with the flush. And cleanse again for the 15 seconds according to facility policy. That's 15 seconds. Next, I will connect my medication. I'm going to keep track with my watch, and we're going to do that over 2 to 3 minutes. I'm going to say that's 1 minute, 2 minutes, and we're at 3 minutes now. Okay, I am monitoring starting now for any adverse reactions. Cleansing again for 15 seconds. Checking for air. Trying to get that little bubble up top. Okay. Again, for that 2 to 3 minutes for about 5 ml. That same kind of rate. And we'll say I've gone at that rate up to the 5 ml because I don't want to bolus the remaining hydromorphone. But now that I'm at that 5 ml, I can just go at the regular speed. One more alcohol swab here. I'm still monitoring for adverse reactions. I'm swabbing at the appropriate amount of time according to my policy. Checking for air. And being that it is a PICC line, I'm going to pulse. And this is ensuring that there's nothing going to be blocking up that PICC line. Okay. Okay, at this point, I can clean up any of my mess that I've made. I'm going to ask Bob how he's doing, how he's feeling. He says he's good. Side rails up, bed at lowest position. Bob's got his call light. I'm going to make sure that there's nothing else that he needs from me at this current time. Once I've done that, I can take off my gloves and wash my hands. I will leave the room and I will go ahead and chart that I gave him this medication at this time through his PICC line. I'll document the additional fluids that I used for the pre-flush, post-flush, and if there were any sort of reactions, I of course would document anything like that. Some lifespan modifications. I would have checked in my Betty book just to make sure that that 0.5 ml or 1 milligram of hydromorphone was appropriate for this particular patient. If it was a peds patient, that might be way too large of a dose, in which case it would raise a red flag for me. I would also just be watching to make sure that, you know, if he needed to be distracted because he was high anxiety whenever medication was giving or something like that, or if he had dementia, I would bring somebody else with me to help out. Let's see, what else is there? I would, yeah, I think that's everything. I would make sure I had washed my hands upon leaving the room, and I would follow up with Bob probably about another half an hour or so afterwards, make sure that that pain was subsiding, and see if there was anything else he needed at this time, or if there was any extreme adverse reactions that I would need to notify the provider about. All of that being said, that is my administration via PICC.